Hey everybody, today we're going to talk about an extremely controversial topic. No, wait, hold up, wrong video. That's next week. Today we're going to talk about something that's going to benefit society. No, not hippies and marijuana. We're going to talk about robots in the medical field. Nobody get mad. We're not going to talk about bad stuff. It's just when robots get brought up, people go from zero to Hiroshima and Nagasaki. It's just bad. But today we're going to talk about how it's going to extremely benefit us and how it's going to benefit us in the future. The first topic is going to be surgery. The second is going to be nursing. Surgery, for one, let's just think about it. Surgery. What are surgeons? Surgeons are humans. And from millions of examples in the past, humans are extremely imperfect. Like, for real. Like this dude, and this, and also this. You get the picture. We're just very, very dumb. Just all humans in general. So, to take out a lot of human error and to prevent this from happening, we can use robots. Or more specifically, robot-assisted surgeries. If you use robots like Da Vinci and Zeus, no, not that one. Yeah, that's it. There we go. If we use these two things, it can extremely benefit surgery. For one, they're extremely more precise. So you take from the little calculator that you used to use, like those mathematicians where you do that little thing, to a supercomputer. That's the difference. For one, they can use VR, virtual reality. Not no cheesy 1990 virtual reality systems. I mean state-of-the-art virtual reality. Like the surgeon actually believes he's right there on the operating table. Also, it has more dexterity. The surgeon is placed in an extremely comfortable position where he can work on the patient for a longer amount of time without being stressed, without being uncomfortable. It's just extremely beneficial. Also, it has diverse systems, and the systems are so good, and all the sensors, it actually tricks the doctor, like I said before, to being actually at the table. It also has, it's not as sensitive. Well, it is sensitive and isn't sensitive. Let me explain. Say I'm operating on someone, open heart surgery, the full 9 yards, and my arm spasms. Oops, I killed someone. Literally. It can happen. It's happened before. Compared when you're using the robots. If you make a big movement on accident, it's just going to make it move millimeters, not even that, on the actual surgery. That's how advanced the systems are. Also, the robot is minimally invasive. I know it's a big word, and all those Trump fans are going to be a little bit confused about this. Minimally invasive means you go from spending 3 weeks in the hospital and 9 months in recovery, and you're going to cut that by 75% easily. Since you're going from making a big old gash in your stomach to do whatever surgery they have to do to making a small gash and getting the same thing done in a faster amount of time. So that causes less pain, less uncomfortableness, and patients are going to have more of a chance in recovery than before. That's the first part. Our next topic is nursing. I know this is going to be even more controversial than the surgery. For one, nurses have a huge emotional value, especially towards the patients. How a nurse treats the patient can drastically affect how the patient recovers. Well, using robots in the nursing field is going to help that by a lot. I know this seems very confusing, but The reason why it's going to help, robots can take all the menial jobs that nurses usually have to do, and which can help benefit the nurses and help decrease the stress, and to be able to use that emotional human sense to help the patients. For instance, the RoboBear. The RoboBear is a robot that can pick up patients and carry them from point A to point B. Carry them distances, like he can carry them from the bed to the bathroom, transfer them from rooms, or lift them from a wheelchair to the bed. Different things like that. Usually nurses have to do that. And nurses, like I said, they're humans. They can get cramps, anything can happen, they can drop a patient. And no one wants to drop an elderly person, that's just bad. Or say you just had open heart surgery, just got stitches, and you got dropped by a nurse. That's not going to end up well. Well, the robot, on the other hand, doesn't get cramps, so you can cancel that out. Like, the robot bear also has less chance of injuring the patient. Like I said, it's not human. It's not going to have the simple mistakes. Another robot that can benefit the medical field is Denso. Denso is pretty much like Siri, but better. Way better. It can remind patients when to take their medicine, what medicine to take, and exactly how much. It can do exactly what a nurse does in that sense. It can make and receive phone calls from the patient's family and friends, so that can also comfort the patient. And it can make simple conversations, like Siri can, but better. So in that aspect, it can free up nurses to do more of the humanoid senses or do other jobs that can help benefit the doctors and to help get the patient recover as fast as possible. So like I said, robots in the medical field are extremely beneficial and will help out society. See? How bad was that?